Hi, it's Georgie, and this is Fempower Health Audio Insights, where I break down the biggest issues in women's health so you can navigate the system with confidence. Whether you are a patient, policymaker, or provider, these insights give you the power to make informed decisions. Today, we're going to talk about what happens when we go to the doctor and we know something is up, and that is why we're at the doctor, but we're told everything looks normal. Well, for many patients who are experiencing pelvic or vulvovaginal pain, these words aren't comforting, they're actually distressing. And I will tell you on Fempower Health, whether it's social media or a podcast episode, anytime I talk about anything related to pelvic pain, it gets spread all across the internet ethers, so to speak, because this is an area people are really struggling with. And we're visiting many doctors and we're trying to get answers and we can't, but we really needed data to show how widespread this issue is. And now we have it. A new study was published on May 8th in JAMA Network Open, and it offers the first patient-centered instrument to quantify adverse care experiences in vulvovaginal disorders. And the findings are staggering. And I want you to hear this because if you are one of the people struggling with a vulvovaginal pain or pelvic pain, you know that you are not alone. So here are the stats. 52.8% of patients have considered stopping care altogether. Yes, you heard that right. Over half of women are so frustrated by being told that their exam is normal or not able to get answers that they just want to stop going to the doctor altogether. And in fact, these patients reported seeing an average of 5.5 clinicians before reaching a specialist. 20.6% were referred to psychiatry without a medical workup. And what this means is like a medical workup for the specific pelvic pain or vulvovaginal pain they were experiencing. And then 39.4% said they were made to feel crazy. And this was actually the most distressing behavior that was reported. So these experiences align with what some describe as medical gaslighting, a term the authors of the study define as the dismissal of a patient's genuine concerns without appropriate evaluation, often due to systemic factors like clinician ignorance or bias. But the study's deeper contribution lies in its framing. This isn't about pointing fingers. It is about epistemic injustice, where patients' knowledge of their own bodies is unfairly dismissed or discredited. And it's not that you're not in pain. We just haven't found the cause yet. So this is really, really important because this is how doctors should be talking to us. So in an Instagram live discussing the study, some of the co-authors of the study were Dr. Jill Kraft, who's been on the Fempower Health podcast, and she talked about 4 causes of vulvovaginal pain or pain with sex, and it was an incredible episode. And another co-author was Dr. Kylie Moss. And they reflected in this Instagram Live on how they've changed their own language in clinical practice. And one of the most distressing findings from that survey is how invalidating it felt to hear your exam is normal when experiencing real pain. So Dr. Moss shared how she reframes it, and it was that quote that I just shared, which is, it's not that you're not in pain or this isn't distressing. It's just that we haven't found the source yet. I'm going to actually put this quote on social because it is probably one of the best quotes of what a doctor should say. It should be in all doctors' trainings on how to talk to a patient when they are really, really trying to figure out what's going on. So anyhow, back to the comments here. So Dr. Kraft, she added that even as specialists, there's times when exam findings don't fully explain what a patient is feeling, but that doesn't mean the pain isn't there, and it doesn't mean it's all in your head. Patients know when clinicians don't know, The other piece of this study that's really valuable is the patient-centered design, because it was built on real patient testimonials and refined with input from advocacy groups like the National Vulvodynia Association and Tight-Lipped, which I highly recommend you following both of them. So importantly, many patients in the study did not assume malicious intent. Instead, they pointed to a root cause of lack of clinician education in vulvovaginal disorders and sexual pain. So as Dr. Moss shared, that patients knew that the root of a lot of this behavior was lack of training and lack of education. And she specifically said, I've been a physician in the healthcare system where my resources and my time are limited, and maybe I don't always have the training that I want to help with the precise problem a patient has. So I know that that is a struggle for everyone involved. So this may help explain why these experiences are so widespread. So it's not necessarily about individual doctors failing, it's about a system that under-prioritizes women's pain, underfunds research, and under-trains clinicians. And the harm is measurable. This isn't about discomfort. Dismissive or invalidating care can cause measurable harm. For one, it can cause delays in diagnosis for conditions like lichen sclerosis or pudendal neuralgia. It can have secondary complications like pelvic floor dysfunction from untreated pain, or emotional trauma that rivals or exceeds physical symptoms, and last but not least, a loss of trust in the healthcare system and in oneself. And yet, patients also reported moments of hope. Clinicians who partnered with them listened without judgment, and acknowledged pain even when answers weren't clear. So where do we go from here? If over half of patients with vulvovaginal disorders are considering walking away from care, we don't have a bedside manner problem. We have a systemic one. So this means rebuilding medical education to cover sexual and pelvic pain, and training clinicians in communication that validates rather than dismisses, and funding research into underdiagnosed, poorly understood conditions, and measuring the impact of interventions using tools like the one developed in this study. And as the authors emphasized, it's not enough to know that these problems exist. We need metrics, education, and cultural change to make care better for patients and for the clinicians who want to help them. So you may ask, Georgie, you've often spoken about educating us on, pelvic pain and what are the root causes, and you interview the experts. And you may have noticed I've really taken a shift in a lot of these insights from all the experts I've interviewed, and now talking about some of these studies that are coming out. And this one is a little bit different because it's helping you see the data around the challenges you may have in the healthcare system, and not necessarily telling you how to navigate pelvic pain specifically as an example. But I think it's really important, if I'm going to be doing this advocacy work for insurance companies, for you as the patients, for you as the clinicians who listen, for even femtech founders, to really understand the true challenges we are having in the healthcare system, because I think all of us have had our own challenges, whether we're building our businesses, trying to help patients, trying to help ourselves, trying to help our loved ones, and just having an understanding of all these behind the scenes things, and now having this amazing data available is so critical, because I think it's actually empowering to know you're not alone. So I hope these different episodes that I'm bringing your way are truly helpful to you in having a bigger picture in navigating the healthcare system. And of course, I always am open to feedback on other things that you may want me to talk about. So please do reach out to me on social media, etc. And I will put a link in the show notes to the resources discussed, as well as the written version of this content. So thank you so much for tuning in, and have a wonderful day. Thank you for joining me today on Fempower Health. If you'd like to continue the conversation, please follow me on social media. I am most active on Instagram, LinkedIn, as well as TikTok. You can also subscribe to the weekly newsletter if you want to stay off social media to get the latest and greatest updates. And you can find a link to that either on my website, fempower-health.com, which is a hub to all the different health topics I've covered over the past 5 years, or you can go to the show notes where there's links to all the helpful resources that are relevant to this discussion. And if you know of someone in your life who would benefit from this information, please do pass this along, because that is how we can ensure this important information reaches those who need it most. And for anything that is discussed medically, please understand that none of what we share on Fempower Health is medical advice. It is all for information purposes only, and only a conversation between you and your doctor can give you the care that you need. Thank you very much.